Hi, this is Andrea Kane from Medical Terminology, HSC 114 at Northeast Iowa Community College. We are here talking about the language of medicine, 12th edition with Davie Ellen Chapner. We are now on week 4, and this is chapter 7 in our book, The Urinary System. In this chapter, we're going to talk about the essential organs of the system, talk about their locations and functions, look at their common pathological conditions, study how urinalysis is used and interpreted. We will definitely be taking a look at combining forms, prefixes, and suffixes as always, as well as clinical procedures, lab tests, abbreviations, and the medical terms in their proper context. So let's get going. Let's see what we've got here. All right, nitrogenous wastes. There are urea, creatinine, and uric acid. And those are the three, so let's keep those in mind. Urea, creatinine, and uric acid. What are the functions of the kidney? The kidney has 4 main functions, and we'll talk about them again. But it's to filter nitrogenous waste to form urine. About 200 quarts of blood are filtered every day just to form 2 quarts of urine. That's a lot of blood that's being filtered. So your kidneys are a very hard-working organ of your body. They maintain the proper balance of water, electrolytes, and acids. They release hormones. Some of the hormones that they release include renin, erythropoietin, and calciferol. And then they degrade and eliminate hormones from the blood. Really quickly, erythropoietin is a hormone that stimulates red blood cell production in the bone marrow, and you may hear it in most often with cancer patients who are getting chemotherapy and need an erythropoietin supplement to produce more red blood cells because they may be anemic due to the chemotherapy. And then if you've ever heard that it's important to take vitamin D with calcium, this is why. Calciferol. It's necessary. It helps absorb calcium from the intestine. They work together, vitamin D and calcium do, to make sure that you get what you need for your body. Organs of the male urinary system are actually the same as female, but they look differently in the sense of how the reproductive organs are associated with them. So I'm going to go ahead and move forward. This is the male urinary system. You can see starting at the top, the adrenal gland sits on top of the kidney. Then you have a ureter that leads to the bladder. You actually have 2 because you have 1 on each side. And then underneath at the bottom of the bladder you can see is the prostate gland. And a couple of weeks ago we talked about a procedure called a TURP, T-U-R-P. Stands for transurethral resection of the prostate. And the reason why men have that procedure is because the prostate gland grows. Hyperplasia, hypertrophy, well not hypertrophy, but hyperplasia. It grows. Those cells, for whatever reason, kick off and grow. And when they do that, they strangle the urethra. They put pressure on it and narrow it to the point where a male could have urine backing up in the bladder. And so that's why they would do that transurethral resection of the prostate to open that back up and keep that moving. Same thing with female, kidney, ureter, urinary bladder, urethra, but it looks different in the sense of, again, the reproductive organs and how they all fit together. You have your adrenal glands, your kidney, ureter, and all of that. But this way you can see how the uterus and some of the other structures fit with it. What is voiding? Well, voiding is a verb. So hopefully that will help you with figuring out what it is. So how do the kidneys produce urine? Well, blood enters the kidneys through the right and left renal arteries. Then arterioles carry the blood to the capillaries, and glomeruli then glomeruli, then can filter the blood. So let's take a look at what this looks like. Blood enters the kidneys through the left and right renal arteries. We saw that, okay? So here's your renal artery. They come in and they go through here, one of the branches. Then they go all the way out to the arterioles, to the capillaries. You can see here are examples of the arterioles, okay? These structures out here. And these little tiny beads at the edge are called glomeruli. And those are the ones that actually do the filtering. The glomerulus and the glomerular Bowman capsule. The blood will pass through those glomeruli, and the Bowman capsule surrounds those, and there's a renal tubule attached to each one. So what does that mean? What does it really look like? So we were talking about how it sort of looked like a little ball structure back here. If we go back, we were looking at these little itty bitty balls at the very end. That's what we were looking at. So if we move forward and now we take a look, you can see that this is sort of a ball structure, so to speak. You can see where the blood comes in on the left, and it comes down, and sugar, water, urea, and waste, and salts are pulled out at this point. Some of this is put back in. Some sugar, water, and salts are put back in, but for right now, what we're studying, they come out at this stage. This stage is the first step in the formation of urine. It's that filtration, glomerular filtration. Water, sugar, waste, salts taken out. Now, there is the next step where at the tubular part, they are reabsorbing water, sugar, and sodium. Okay, water, sugar, and sodium get reabsorbed. Also in the tubular secretion, after reabsorption, there's a period where acids, potassiums, and drugs are secreted in. And let's see if we've got, yes, we have a visual of that. So here we go. You've got your arteriole. Here is step one, the glomerular filtration, where the water, sugar, salt, waste are all pulled out. A little bit further down, the water, sugar, and some salts are reabsorbed into the blood. They get pushed back into the blood to be reabsorbed. A little bit further along in the process, they pull out any acids, potassium, and drugs. And these are the 3 steps to making urine. You filter everything, you reabsorb some of it, you pull in the secretions, and together what's left is your urine. 95% water, 5% waste. It contains, went back the wrong way, urea, creatinine, salts, acids, and drugs. So that's a really helpful visual if you're looking at the process. The glomerulus and a renal tubule combine to form a unit called a nephron. And there are more about nephrons in your book, so I'm going to point you there to read up on those. And this is just a visual to help you see a little bit more of how that all works together. And I will let you hunt through your book for the answer on this one. All collecting tubules then lead to the renal pelvis. Calyces or calyxes are the small cup-like regions of the renal pelvis. And here's what it looks like. You can see what those look like here. So let's go back. The 4 functions of the kidneys. They remove the oh, mercy. Nitrogenous waste. Sorry about that. They balance water and electrolytes, they release some hormones, and they degrade and eliminate other hormones. So this is the 4 functions of the kidney. I like this visual because it really shows you the pathway that it goes through. And you can see how the secretion and reabsorption take place through the renal tubule, and then what's left is urine and how that is excreted through the body, while the other is then put back into the bloodstream. So let's talk terms. Arterial, calyx or calyx, similar spellings. Catheter, cortex, creatinine, electrolyte. Erythropoietin, filtration. Glomerular capsule, glomerulus. Hilum. Kidney, meatus, medulla, nephron. Nitrogenous waste, potassium, reabsorption, renal artery. Renal pelvis, renal tubules, renal vein. Renin, sodium. And I want to make sure I pronounce this right. Trigon. Trigon. Okay, trigon is the triangular area in the urinary bladder. Trigon. Urea, ureter, urethra, uric acid, urinary bladder, urination, same thing as voiding. And notice that there's another word for it, micturition. Micturition. Okay, some combining forms. Remember our equation. A root plus a combining vowel equals a combining form. So you have calio and calico. Sort of like calico, if you want to say it, sort of like a calico cat. Cysto, glomerulo, meato. Nephro, hyalo, reno. Trigon, O. So trigon, O. Uretero, urethro, vesico, albumino, azoto, bacterio, dipso, calo, keto, ketono, litho, nitro, nocto, oligo, poietin, pio, trypsi, uro, urea, and urino. So, moving on to urinalysis. What are tests included in a urinalysis? Well, they're looking at color. There's much that can be told through the use of color. Again, appearance. And by appearance, is it kind of thick and cloudy? Is it clear? Is it there seem to be particles in it? Is there any blood in it? That kind of thing. pH, to see is it acid or basic. Protein, glucose. Specific gravity, ketone bodies, sediment. Phenylketonuria, bilirubin. So now they're going to ask you about urinalysis, and I'm really going to refer you back to your book for this because your book does a great job of talking about what is in a urinalysis and what does each aspect, why is each aspect performed. So I'll direct you to your book for this. So pathologic conditions. What can go wrong with a kidney? Glomerulonephritis. You have an inflammation of the glomerulus part of your kidney. You can have interstitial nephritis, nephrolithiasis, where you have some stones involved, nephrotic syndrome. This is showing us a polycystic kidney. Polycystic kidney disease, or PKD, is where the kidney develops a lot of these cysts. And that is not good for a kidney. All right, some other things that can happen with the kidney. Pyelonephritis, renal cell carcinoma, renal failure, renal hypertension, Wilms tumor. Here's an example of renal cell carcinoma. You see that tumor of those very unusual cells there that have grown, taken off, and become aggressive. Bladder cancer, and then diabetes is associated with kidneys, even though it's really more of an endocrine disorder, and we'll spend a lot more time with it once we get to the endocrine chapter a few weeks from now. What is a term that means frequent urination at night? Frequent urination at night. Is there one of these that has a root that means night, perhaps? Just saying. All right, lab tests and clinical procedures. Lab tests. You will often hear of a BUN being ordered, blood urea nitrogen, and creatinine clearance tests. And again, these are in your book. I would refer you back to look at those there for more detail. There are plenty of radiology studies or diagnostic imaging that can be done on the urinary system. Everything from CTs, MRIs, with and without contrast, angiography, pyelograms, cystourethograms. I have heard of KUB as an X-ray or a CT. It's amazing what you can find with these tests now, how sensitive they are and the detail they can give. And again, you can see this is with a contrast to show how it's avoiding. There are ultrasounds that are done. There can be radioisotope scans performed. MRI, of course, is often used. Some other procedures you may hear about is cystoscopy. That's using an endoscope to go up in there and take a look around, maybe even perform a procedure. There's dialysis. If you've ever heard of kidney dialysis or end-stage kidney disease where someone is on dialysis, they're having to use a machine to do the filtration that their kidneys can no longer perform. Renal angioplasty, that's very similar to cardiac angioplasty where they're going in and they're trying to remove whatever plaque or clot is a barrier. They can perform biopsies, transplants, and of course urinary catheterization is a very common one. This is an example of a cystoscopy. It gives you an idea where you can see the scope and you can see that there's light, there's water, and they can even add instruments to the end to go up in there and take a biopsy or that type of thing. In this case, they're just taking a visual exam. Hemodialysis, also known as dialysis, this is when a patient can no longer, their kidneys can no longer filter their blood for them, so they need to put it through a machine, and that's what this process is. Continuous ambulatory peritoneal dialysis. Now this is much more rare and much more challenging for patients. But again, you can read about this in your book. So some abbreviations here. I'm not going to read through them all, but there are things that you need to know. And again, plenty of them to learn. And most of them make sense, like UTI, urinary tract infection, that's fairly common. The abbreviation RP is associated with which of the following? I'll give you a hint. Let's go back one. Oh, it's not there. Ooh, ooh. They're really challenging us today, aren't they? You know, I have to say, one of the challenges is sometimes these slides are not correct. So disregard this one. It's a good idea to look up these definitions and figure out what their meanings are, but none of them will end up with really being RP, I don't believe, based on where I'm at and what I'm seeing. So I'm going to ask you to disregard this slide. All right, some combining forms. Albumino, angio, azoto, bacterio, calio, or calixio, or calixo, or it almost looks like calico, as in a calico cat. I think it would probably, excuse me, depend upon the suffix that you put with it as to how that was sung. Cysto, dipso, glomerulo, glycoso, hydro, isho, calo, or calo, keto, ketono, litho, miedo, natro, necro, nephro, nocto, oligo, pio, pylo, reno, trigono, uro, uretero, urethro, urino, vesico. And then we have some suffixes: ectasis, ectomy, emia, esis, gram, lithiasis. Lith, for whatever reason, is stone. So if you can remember that L-I-T-H, lith, means stone, that will help you out quite a bit. Lithotomy, lysis, megaly, oli, or I'm sorry, ol, osis, pathy, plasty, waitin, ptosis, rhea, sclerosis, stomy, tomy, trypsy, urea. Now some prefixes: an, anti, dia, dis, n, peri, poly, retro. The combining form dipso means what? Dipso. This is one that you should know. You probably learned it back in the chapter for week 3 when we were talking about the digestive system. I think it was there. Combining form that means pus. Here's another one that you should know. Combining form isho. What does that mean? All right, that's it. So this is it for week 4, chapter 7, urinary system. Hope you're having a great week and look forward to talking to you next week about chapters 8 and 9. Take care.